So thanks for the opportunity to be here today. It's very timely and important to be talking about this issue. It has been kind of hidden for a long time. We have had more of a focus, particularly from the alcohol policy perspective, around public violence. And so it's very pleasing to me that this issue has kind of moved up on the agenda. And in fact, in Victoria, I'm from Melbourne, there's a Royal Commission into the prevention of family violence at the moment, and they had a whole stream on Friday looking at the issue of alcohol and drugs and the contribution to domestic and family violence. And so I was able to present, some of the perspectives of the women that I've interviewed for my study as part of that Royal Commission. So it's very, very exciting times for this issue. Just some acknowledgements of my supervisors and also funding and support there. What I wanted to do was start with just a little history lesson. I don't know if anybody would know who this is. This is Frances Willard, who is one of the presidents of the Women's Christian Temperance Union. And in the States, they were very active in the late 1800s. And one of the connections with this issue of domestic and family violence is that Frances Willard campaigned for women's political empowerment on the platform of home protection. And that's really about the fact that so many women were suffering from the impact of their partner's alcoholism, not only in terms of violence, but also the fact that their whole home life was crucially affected by their partner's drinking. And so the notion of women having some say and having some power to actually campaign to have alcohol's availability reduced was an important kind of feminist issue and resulting in women's political empowerment. So I think this issue it is quite kind of contested and quite sensitive, but it's important to understand that this has actually a long history of women's voices really activating for change around this issue. And as Catherine Murdoch wrote, she said that temperance fueled as important a contribution to the women's movement as abolition. Slavery fueled discussion of the innate equality of humans of all races and sexes. Intemperance forced consideration of inequality and abuse within the American family. And so I'm not necessarily advocating for temperance in terms of it being a viable policy, but certainly the principle around we need to do something about the availability of alcohol in terms of the connections with violence has been a long-standing one. So my study, I was very interested in women's experience of fear and harm from an alcohol-affected partner and really wanting to make sure that we understood this from the perspective of women. Now, unfortunately, I was wanting to present a nice diagram of what women have talked to me about in terms of the kind of the cycle and the patterns of their partner's drinking and how that the associated behaviours and their strategies. I'm unable to actually present the actual image, but I will kind of talk to it. The fact that of the women that I've spoken to, they intimately connect patterns of their partner's drinking with their experiences of fear and harm, and they use very similar terminology to describe these very recognisable stages. And so when I do come to publish my findings, this cycle of drinking, this episode when a partner starts drinking is when it starts off being fun and he's light and happy. Then it starts to become more targeted behaviour in terms of being very directed towards her. And then there's this move to this escalation and really aggressive, pretty horrible behaviour that happens. Doesn't happen every time, but then women talk about this flip or a switch that can happen. And then there's the kind of the de-escalation down to basically when he gets drunk and passed out. And so I thought what would be best to illustrate this would be through some quotes that women have talked to me about. So once he started drinking on a Friday night, then Mr. Bouncy would come out again. But Mr. Happy started turning into Mr. Sarcastic and Mr. Making personal remarks and then being threatening and then, hurting. So Kat's experience of the women that I spoke to was really quite severe abuse that was very recurrent when he started drinking. And Kim talks about this is at that what I call the frightening stage, when it really escalates. And she talks about when he would start to put his face right into my face. That was the start of it. So just that really intimidating. Put his face right up to me and talk through his teeth and, be quite verbally aggressive, but with his face probably an inch away from mine, which was, and I would be backed into a corner. So a lot of the studies that have been done have been, measuring types of abuse connected to alcohol, and they do identify, say, verbal abuse. And what comes out in my study is that this verbal abuse has a really physical element to it, and so women are incredibly frightened, particularly where there's significant physical differences between them. And just thinking again through that notion of it being a cycle, Carla talks about, I'll usually wait for that stage when he'd be too drunk to do anything, when he'll be unstable on his feet. That was the moment when I knew I was pretty much safe. And so part of this cycle that women talk about, they identify certain stages as being unsafe and safe, and they have adaptive strategies for trying to prevent escalation, but also protecting themselves and their children when the inevitability happens. So I hope to be able to publish that later this year. So what I just wanted to go on to was just about the role of alcohol in intimate and domestic intimate partner violence, I'll call it from here. So what we do know is that not all partner violence is alcohol related, but it is involved in a substantial amount of partner violence. I won't go through all of these, but just to give an idea of some of the proportions that we're talking about. So it's not insignificant. So in terms of the link between alcohol consumption and intimate partner violence, there is a strong evidence of an association, and there's actually decades of research that has shown this. So the cross-sectional studies that really give a snapshot in time, often based on kind of survey results, they tell us that there are high rates of alcohol problems in men who are violent, and alcoholic males seeking treatment have higher rates of intimate partner violence than the general population. So, and this relationship between intimate partner violence and alcohol use it's consistent no matter what kind of population you're talking about. So whether it's in the emergency room, studies in healthcare settings, the population surveys, the young adults, all these various samples, it's very consistent that there is this association between alcohol consumption and increased risk of intimate partner violence. The longitudinal studies, so looking at particularly studies of couples over time, does show that higher rates of drinking in early marriage is predictive of intimate partner violence later in life. Also studies in laboratory settings where looking at particular, when there's kind of simulations of discussions between men and women to kind of establish the role of alcohol in increasing verbal aggression. That holds true in these laboratory settings, but of course that's not necessarily indicative of what happens outside in the real world. But still, those lab studies do show this kind of dosage effect in relation to aggression and alcohol. So really, there is a lot of evidence out there to show it is linked. In terms of a range of theoretical explanations to understand this relationship, so we do know that alcohol has an effect on cognitive abilities, and it inhibits your executive function, so in terms of being able to make good decisions and being able to resolve problems. So certainly when you think of it within an intimate couple relationship and where someone is under the influence of alcohol, and particularly both, it does increase the risk of aggression where couples are unable to deal with the problems given the effect on cognitive functioning. Certainly when there's theoretical explanations around if you expect to be aggressive when you're drunk, then you'll will go on to be aggressive, which sounds like a bit of a no-brainer, but certainly the research has shown that's true. So if people who have higher expectations that they'll be aggressive, then they're likely to be that under the influence of alcohol. This notion of alcohol myopia, so this is where basically when you are under the influence of alcohol, your focus becomes narrowed. And so that means you kind of miss any other external cues. So when you think about it, again, in a intimate partner interaction, then you will focus in on what's kind of going on for you, and not understand any other kind of factors going on around you. So, and thinking about what the women tell me about, they say that, look, you can't reason with him when he's drunk. So I don't even argue. I just shut down, and they adopt what I call tactically passive strategies, because they just they just know that he is not able to hear anything or reason with her. This notion of social learning and kind of cultural explanations is where I suppose, if you do know that drunken behaviour and drunken aggressive behaviour is tolerated in the community, well then you're more likely to have that belief and in a way excuse your own behaviour as a result of that. There is another theoretical explanation around responsible disinhibition from Sarah Galvani in the UK. Her theory was around there's both a choice to drink and a choice to be violent. And so ultimately it is about making certain choices, but within the context of disinhibition as well. But certainly she focused in on the choice to drink and the choice to be violent too. But what kind of comes out with the theoretical explanations is that there's no kind of clear single cause or pathway that satisfactorily explains everything. So I think what's important from my understanding is that we think of this as very complex behaviour that can be approached in a whole range of different ways. So what we do know is that heavy and binge drinking increases the risk of partner violence. It is more severe when one or both of the partners drink. And so while there are questions around that causal pathway, what we do know is that it actually makes things worse. And so alcohol does play a contributing role in intimate partner violence. So again, thinking about the level of complexity of this particular phenomenon, one of the first things I did with my PhD was to try and understand, well, if there's been this decades of research to show this association, what's been done that has looked at alcohol's role in intimate partner violence in terms of having an effect on reducing partner violence. And so from my alcohol policy background, I wanted to look at the evidence in terms of the different levels of the ecological model. So that was understanding that behaviour is not just influenced at the individual level. There's aspects, factors within the relationship, the community, and also more broadly in society that influence that behaviour. And so what I did was I specifically looked at particular alcohol policy measures that have been known to be effective, as well as basically looking at any kinds of interventions, and to actually really see what's been done and what's been effective. And so at the broader level, thinking about alcohol pricing and taxation, having an impact on alcohol consumption, the availability of alcohol in terms of restrictions on its sale and alcohol outlet density, and I'll talk about that a little bit later. And also in the relationship level, thinking about any couple-based treatment and individual treatment. So I looked at evidence over the last 20 years. And really the most disappointing thing was that despite the raft of evidence of the association, when we're coming to interventions, it's a very neglected space. So just in terms of the pricing and taxation measures. So when we think about alcohol pricing, the underpinning theory there is that if you make alcohol more expensive, then you're likely to reduce the demand. And in fact, there was only really, it was a very limited evidence base that we found. And one study did show that a 1% increase in the price of pure alcohol was associated with up to a 3.5% reduction in wife abuse. But we also had some kind of questions in terms of the actual design of that study as to really, was that a kind of a real impact that they found. So, and there was a range of other studies in the States that looked at changes in their kind of prices, beer prices in various states, and looked at that against domestic violence rates. But they didn't find any kind of significant findings, and I think there was a lot to do with the types of studies that were done. So in this space, we actually do need to know a lot more about how price can actually make a difference when we think about alcohol perpetrators who use alcohol. When we come to alcohol's availability, so the idea there is that by reducing the physical availability of alcohol, it does actually increase the effort to obtain alcohol, and it decreases consumption and harm accordingly. Now, so I looked at studies that restricted trading hours, and there was one study in Brazil which, because this particular city had massive problems with alcohol consumption and high rates of homicide, I think it was the mayor of that city introduced this blanket 11 o'clock closing for all the bars in that city, and so they actually did find significant reductions in homicide and reduction in violence against women, but it wasn't statistically significant, but certainly it was a trend in the right direction. So it was about 17% reduction. There's been a lot of studies looking at restrictions in Aboriginal communities. There's some different kind of mixed results in terms of the impact on domestic violence, but certainly in Fitzroy Crossing they had some significant reductions, and but a corresponding increase in police reporting. So it's kind of hard to kind of know what that actually means. But certainly in terms of presentations to refuges and to hospitals, they found reductions in alcohol-related domestic violence. So some potential direction there to follow, but there also needs to be more rigorous kind of evaluation of those interventions. We think about alcohol outlet density. So the idea there again is that the number of outlets concentrated in certain areas has an impact on the availability of alcohol. And in Melbourne, there's been some good research to show how over a 10-year period, the increase in the numbers of alcohol outlets has been associated with an increase in family violence police incident rates. But certainly, that information, those types of studies point us in a particular direction for more research to understand those particular links. And there's a couple of other studies in the US that do show some associations, but it's not clear whether it's a kind of packaged liquor outlets versus on-premises outlets that are have the greatest link to partner violence. And in the Australian study, it was a clear link with packaged liquor. So, in terms of the studies that look at the treatment sphere, we did find that again the study designs kind of weren't so convincing. That, but there was a study of university couples that did show that brief interventions had some reductions in physical violence as well as alcohol use, but these weren't necessarily linked, so that we couldn't necessarily determine from the those studies that the reduction in the alcohol use actually had an impact on the actual reductions in the physical violence. And there's a range of other studies that do show, with behavioural couples therapy, some reductions in violence following treatment. But the types of studies, the study design didn't allow us to attribute those results specifically to that type of treatment. And there were also increases in violence where patients had relapsed. So there was some, again, pointing in the right direction around reductions in alcohol use having an impact on reductions in violence. And when it came to the individual treatment, again, not terribly convincing, but just mainly because we're lacking some good studies there. But certainly with alcohol brief intervention added to a batterer program compared to just like a group session of where participants were given information about alcohol use within that group session, where the brief motivational interviewing actually had more of an impact than the other, but reductions of those effects happened over time. And there was just a few other studies that again showed some limited evidence. But the studies that were kind of the before and after studies, they did show some reductions in violence connected with alcohol use. But again, we're a bit limited by the study design. So I suppose that slightly depressing news about the state of the intervention evidence. But I suppose what we do know is that this is an area that's ripe for further research. We do particularly need to have more research looking at younger populations. Quite a lot of the, particularly in the treatment field, those studies were really looking at older, middle-aged, or older couples in longer relationships. And we do know that starting to address these issues in younger couples where behaviours can then become entrenched further on in life. So it's really important, particularly where we know partner violence there's high rates in the 18 to 24 year bracket, as well as they're the age group that are likely to be binge drinking quite heavily. And so having some better research quality and also targeted interventions at all of those different levels, so not just in the treatment sphere. And it's just interesting thinking about the keynote presentation earlier. There is an approach that's been used in South Dakota called the 24/7 sobriety program. So that is actually a criminal justice a program which is actually addressing recidivist drink drivers. And what they do is they have to avoid arrest, the drunk drivers actually have to go present every day, twice a day, to be breathalyzed. And if they're not been drinking, then they avoid further kind of punishment. One of the things that they found with doing this is that they actually had significant reduction in recidivist drink driving, but also they didn't expect to, but they found a 9% reduction in domestic violence. So, so that was just an interesting thing where showing how reducing the alcohol consumption in a population that is heavily at risk for domestic violence, then it did actually have an impact. But also noting that's probably something about compliance as opposed to necessarily making the ultimate behavioural change that's needed. So I think those are the things that need to be further explored with those types of interventions. Or just a range of other things. This is my kind of wish list of things that we could do in this space in terms of improving data collection, making sure we're measuring the right thing, and also making sure that when we have interventions such as, for example, in New South Wales, the lockouts and the restrictions in trading hours in response to some, the whole coward punch things that have been happening in the entertainment precincts, that we're also thinking about what's the impact of those interventions on domestic and family violence. So one of the things that I would leave you with is that alcohol use is actually one of the factors in this very complex issue of intimate partner violence that is really open to doing something about it. So I think that's an opportunity that we should take up. And just to finish on a quote, so even with for some of the women that I've spoke to where they've left the relationship and they're even starting new relationships, this experience stays with them, and particularly in relation to the drinking. So Carla says, 5 years now on, we've got a child with her new partner, and I'm still waiting for the moment when he'll become drunk and angry. And she calls herself, we're the damaged goods, me and my other kids. So thank you.